The views and opinions expressed do not necessarily reflect those of Access Fort Wayne, the Allen County Public Library, or any other supporting groups. If you'd like to produce a show, call us at 260-421-1250.
Hi, I'm Dr. Rudy Cashman, neurosurgeon, Fort Wayne, Indiana, for 42 years, but only 39 years old. No, all kidding aside, you can call me Dr. Cashman, you can call me Dr. Wellness, Dr. Second Opinion. I've written about 5 books about proper eating, and tonight's subject is a fascinating subject, and I'm doing it with Dr. Gary Verula, pediatrician from Fort Wayne, Indiana. He has a beautiful office across Jefferson Point at 3819 West Jefferson, and naturally him being a pediatrician today, our subject is the children's non-diet. We're speaking about not a diet, but a proper way of eating. Good evening, Gary. Good to see you again.
Good to see you, Rudy, again.
We've formed this partnership here. Actually, you wouldn't believe it. Dr. Rule and I, once a month, give cooking classes. I mean, to our just delight, we have children come in, and on his prescription, I've seen him do in the office, and he's just beautiful. If they, have some weight issues, he'll write on the prescription pad, cooking class. Isn't that beautiful, Gary? I just love it. And today's subject will be very interesting. We're doing about 4 DVDs on this subject at least, and probably a few more. And I'll just briefly, for a minute, will summarize what we talked about last week a little bit about the way of eating, the non-diet. We're calling this is not a diet, it's just a way of eating. We're not asking the child to practice restricting the amount they eat. It's just a type of food they're eating. This is what we're big on, isn't it, Gary?
Yes, exactly.
In essence, what we're really saying is to eat complex carbohydrates. That's carbohydrates that still have their fiber in them, and complex sugars, not simple sugars like processed foods like white bread or mashed potatoes. That's almost pure sugar. Potato being an example, sweet potato would be an example, a carrot would be a complex carbohydrate. 100% whole grain, 100%, that's grain with still its coverings on it. It's not white rice, that's not whole grain. Brown rice is whole grain, for example. Things that still have the bran on them, so you have to look for the label. 100% whole grain, all types of vegetables. We're not picking one vegetable or another. All types of vegetables, beans, all you can eat, and fruit, all you can eat. This is the basic diet we are recommending. Dr. Gary in his practice doesn't frankly recommend meat at all. It's not a health food. Is it, Gary?
Yes, I tell them to avoid it as much as possible because there is so much choices in the vegetables and the legumes and fruits and everything where they can get a complete whole nutrition just from even avoiding the meat and the eggs and the dairy.
Yeah, and we're talking really, I mean, what's in the food that we're recommending? It's got all the vitamins in it, 14 vitamins. It's got about 60 minerals in it, mainly about 16 or so, but it's really 60 minerals, and 25,000 phytochemicals. Phytochemicals is the chemistry and the enzymes that run our metabolic system. This is what people forget in proper eating. It is the orchestra of these working together that result in excellent health and the low weight. And the rainbow of the fruits, I love those terms, isn't it really,
yes,
Gary?
Yeah.
Fruits of color.
Right, it's this symphony of the orchestra of all these phytochemicals that help your immune system to build up and fight all the infections and stay healthy.
Yeah, and avoid cancer. And if you eat this way, you're going to live to be 100 unless you get hit by a Mack truck.
Right.
And be intelligent to boot and avoid most illnesses
Yes.
and diseases. So, let's get more specific here. Let's talk about the mother today a little bit.
Yes, of
okay.
course.
And tell us a little bit, what should the mother's diet be before pregnancy? I mean, the brain of the child and the illnesses of the child really are almost predetermined. How the mother eats
Yes.
before pregnancy is important. Tell us about that.
Yes, it is very important for mother to maintain a healthy, nutritious diet even prior to conception. And most of that includes healthy whole grains, a lot of fruits, vegetables that gives all the phytonutrients, natural vitamins in the vegetables, the minerals, and the calcium as well, and the proteins also that includes in all the vegetables.
Yeah. Thank you, Gary. In other words, a mother's diet before she ever conceives is really critical to her child,
Yes,
isn't it really?
it is. It is.
And it really determines the mother's milk when the child is eventually born. What about throughout the pregnancy? Tell us about the type of eating a mother should do during the pregnancy.
Again, I would recommend mother to be eating generally lots of fruits, lots of vegetables, mostly legumes as well for the proteins, and include a whole wide array of what you find in the supermarket. I generally recommend to eat most of the things. If they are available in that season, you can really eat a lot of those in that season particularly, and still not having to buy expensive exotic foods just to complete the whole spectrum.
Yeah, eat at least 50% raw vegetables and
Yes.
beans and fruits, and maybe cook 50% and eat a few, maybe ounce of nuts with it,
Yes.
for example. So after all, what the mother is eating, her little baby is eating also, isn't she
Yes,
really?
absolutely. Whatever she's taking, going straight to
Yeah.
the baby.
And if you're developing diabetes during your pregnancy, for example, you're hurting the baby. I mean, it's
Yes.
going to harm the baby.
It does.
It's much more likely for the baby to be abnormal, developed neural tube deficits,
Right.
for example. And the mother must avoid alcohol and cigarettes and the fat in meat products, for example, has in a lot of enzymes which can affect the
Right.
baby. And the cancer rates in babies goes up if they're eating the nasty food. Isn't that true, Gary?
Yes, that is definitely true. There's a lot of increased incidence of lymphomas and testicular cancers in men well into like 30s and 40s or 20 to 50 years after they're born, of course. So that is a reflection of the impact of in utero nutrition of the mother at that point.
Yeah. Tell us a little bit about mother's milk and breastfeeding and how good it is for mother for maximal brain growth and maximal health to breastfeed a child if she could till age 2. Although the average is about 8 months, 6 or 8 months, isn't it? Tell us about that a little bit, the advantages of breastfeeding.
Oh, there are many advantages of the breastfeeding. Breastfeeding is actually the best nutrition for the child. It helps the child to transit from in utero to the external utero, and then subsequently helps the baby's maturity, brain growth, immune system, and the gut development in the early stages, like first few months, and subsequently the whole growth of the child, including the infection fighting capabilities. It is a tremendous fluid made by the mother, which the child can consume and have a complete area of nutrition just in the breast milk.
Yeah, and the chemicals in the breast milk, the immunoglobulins,
Yes.
for example, and there are live cells in breast milk, which
You're
I
right,
didn't really
they're
understand. There are
live
live cells which a child can absorb because the gut in an infant is like a sieve and allows those mothers' immunoglobulins to get into the blood system and fight illness. So if you breastfeed your child, it's much more likely not to have asthma and allergies and all sort of illnesses and in childhood cancer even
Yes.
if they breastfeed. You were telling me earlier that even in a premature, if they have a premature child, for example, that the mother's breast milk, the body compensates for that and has extra extra chemicals in it to help a premature infant to thrive.
Right.
Tell me about that.
For especially if the baby is born pretermly, the mother's content of the milk is a lot different than a baby born at term age. That particular milk is necessary for the baby to grow properly in the first 3 to 4 weeks or 6 weeks of the preterm life of the child.
That's fascinating. In other words, the body accommodates the premature child. I mean, that's very interesting. Now, you would suppose mothers breastfeed most of the time at least 6 months, and suppose you stop at that point. What should the mother be feeding the child at about 6 months or so?
Usually they need to continue to do the formula feeding at least, or something to supplement the breast milk till at least 1 year of age, and subsequently they can go to regular foods and all this stuff. They don't need any formulas at that point. They can transition to either whole milk, or they can transition to soy or other types of milk where they can get their nutrition from.
Yeah, let's talk about milk here a little bit. Let's talk about cow's milk. What's cow's milk supposed to be for?
Cow's milk is actually very good, very tasty, very nutritious, but it is the best thing for the cow, baby cow or calf. In fact, the amount of nutrition and the amount of enzymes and the hormones in the cow's milk help the calf to grow about 100 pounds a month. So it's very useful for the cow. It's not really specifically made for the human babies.
Thank you, Gary. I mean, what is he saying here? Cow's milk is meant for cows, for the children of cows, not for humans. It's full of proteins you become allergic to. The type 1 diabetes rate increases.
Yes.
This is a very huge study has proven
Right.
that there's a much higher increased rate of type 1 diabetes in infants been fed on cow's milk. In looking at Dr. Furman's book, he wrote some book for children, very important. This is what he's saying, where there's strong links to cow's milk. And you were telling me it's a very common cause of acne.
It is. It is an important reason for acne, especially in, of course, teenagers and adolescents. And it gets actually worse with the increased intake of milk and dairy products, cheese and ice cream. Of course, children at that age, they practically live on dairy products, mostly eating outside pizza, cheese, and fast foods and all that stuff. And it is very hard for them to stop, actually. But I have a teenager in my office who actually stopped the milk for about 2 months, and he came and showed me how well his acne is, and he's not taking any medications for it.
Well, that's very interesting. Other things associated with cow's milk, many allergies. This is Dr. Furman's book, anal fissures, childhood type 1 diabetes. We mentioned that already, where you have the pancreas dies, and chronic constipation, Crohn's disease, bowel disease, higher rate of ear infections. Dr. Furman in his book, and I've spoken to him many times since he's a friend of mine, since he teaches his parents not to feed his children with cow's milk. His children have much less ear infection, much less angina. He rarely has them have cancer, reduced heart attacks, multiple sclerosis, prostate cancer down the line. And as we mentioned in our last disease, when does vascular disease begin? At age 1 or 2. You check the cholesterol in children at age 2.
I checked them from about 2
like
years
Dr. Atwood in his famous book recommends.
Right.
Because we can start painting our arteries, eat the wrong food at a very young age. So what's health equals nutrient density. Remember we talked about the food pyramid here. And we spoke about the nutrients, the phytochemicals, although the vegetables and cruciferous vegetables and beans and nuts we recommend, that's a nutrient-dense food. You see, a steak, meat, for example, is an empty calorie. I personally think the name should be changed. It shouldn't be called empty calorie. We should call it a toxic calorie. It's full of toxic calories, fat.
Yes.
What's a steak? 80% fat, and it has a growth hormone, which helps cause cancer. So eating meat products really is not a good idea. So health equals nutrient density divided by calories. That's really a health formula. I meant to bring up, what about the diet? For example, starting at age 2. What would you recommend for a child starting at age 2? 2 to 6, say.
2 to 6, I mean, they should be eating everything from the table, of course. And again, I recommend basically a wholesome foods of fruits, vegetables, legumes, beans, and they can, of course, milk can be, a small amount of milk, dairy can be used if they're not allergic, but otherwise they can also use some soy milk or some almond milk, because they just don't need a whole lot of calories from the milk aspect of the diet.
Yeah.
They can get a cup or two from soy milk or almond milk,
Yeah.
and
Yeah.
still manage the complete nutrition
Yeah.
from all of the sources.
Okay. And in other words, they can eat essentially regular food.
They should be eating regular food.
Right
really.
off, right at the
Yes,
table.
Yes.
Yeah, but you should, and they need to watch taking them to fast food restaurants, isn't it?
No, no, that's,
And when I go to fast food restaurants and I see the mother bringing their child, for example, for French fries and cheeseburgers, I mean, to me, it's, I hate to say it, it's almost child abuse. It's almost child abuse, and I see it all the time. 50% of the kids eat at fast food restaurants. Very unhealthy thing to do. They're killing the child. They're restricting the growth of the child. They're restricting the child's brain, especially increasing their illnesses. And what about eating from age 10 through 18? Essentially the same as we were speaking about.
essentially, I mean, same thing, but at that point, they have to concentrate on consuming probably more beans, legumes, and of course they have to have big servings of salads. Kids that age can eat salads, and of course start with a big breakfast,
Yeah.
and maybe a nice lunch, some snacks in between, and again, fairly decent dinner with some salads again. I encourage a lot of them to eat, all of my patients to eat a lot of salads with their regular meals, and then a lot of fruits as well.
Yeah. Children are not born with taste buds for fat, which is kind of instinct. It's sweet,
Right.
salt, and sour. And we have to teach them to like fat. So if you never present fatty foods to your child, then they will not develop the taste for them. We have to
Right.
teach them
It's
to
a
do
learned
that.
behavior.
It's
Yes,
a
it is.
It's a
It's a learned
learned
behavior.
behavior. So it's very important as a very young child to teach them to eat this nutrient-dense way of eating. I like to
Yes.
call it the non-diet, the nutrient
Right.
way of eating, with all these phytochemicals and minerals and vitamins. If you teach them that way, they will not want fatty foods. You got to teach it to them. And of course, when they go into high school, you've got to watch what the school gives them. I mean,
Right.
if I was a mother of a child today, I mean, I didn't know this all years ago myself, but if you a parent today, you ought to go to school and look at what are they feeding your
Yes,
child?
yeah.
Are they bringing in these fatty foods that the government gives to them off some of these farms that are full of chemicals and have been hormonally treated and have
Yes.
growth hormone in them? They're going to injure your child, and you can get it for free. Because the school doesn't, many schools don't screen what they're feeding the
Don't
children.
screen. Most of them, they
Yeah.
just provide whatever is available, probably inexpensive kind of foods,
Yeah.
especially the fast foods.
Yeah.
And also kids tend to favor fast foods over other foods just because probably lack of a good idea as to
Yeah.
what their nutrition diet should consist of.
And let's face it, parents. Let's face it here, including myself. You have to lead the way on this, and you have to talk to the school people that are feeding the wrong food, or join a committee. But you, as a parent, must set an example. If you're overweight, and both parents are overweight, your child's got an 80% chance of being seriously overweight. So that's very important. That as a parent, your child would eat the way you eat. Let's face it. And for example, I had talked to a patient today, and they had been to Disneyland, and they were telling me how serious a problem we have with obesity in this nation. What they saw was just unbelievable. And matter of fact, now on the rides, they have sample chairs there, so you can measure yourself as to the size chair that you will need. They can't use an
Wow.
average chair no more.
Yeah,
You have to
yeah.
especially accommodate chairs, just like we at the hospital, especially accommodate operating room tables and gurneys and things. It's sort of sad. I mean, and they saw it, in a huge quantity this weekend when they were in Disneyland. And then of all things, they told me they had heard that a fast food restaurant in town is going to make bacon sundaes. Would you believe it? Bacon sundaes.
Unbelievable,
And I
yeah.
asked them, is that accompanied with a free angioplasty? That's sort of a little benefit.
Yeah.
But apparently it's a true story. I can hardly believe it. But now that we reach the teenage years and very young infants too, let's talk about a little bit here about liquid calories. Liquid calories, I think, which is a great cause of obesity. If you drink your calories, and you're not looking at the labels, this does not decrease your appetite for regular food. So in other words, you can, even the average drink today that children drink is about 180 calories. That amounts to 18 pounds in 1 year. Your child will gain 18 pounds just from what they're drinking
Extra.
in. And I met a mother of a patient of mine the other day in the elevator. It was Saturday night late. I was at the Lutheran Hospital. And she was kind of mad at me because I didn't recognize her. Well, what had happened was I didn't recognize her. The reason was she was another person. She had lost 40 pounds. So I
Okay.
didn't recognize her. And she was a mother of a brain tumor operated her child. And she told me the only thing she had done is stop drinking her liquid calories. If you drink a lot of calories with a lot of sugar in them, this does not turn your appetite off. That's your stuff in addition to what you're doing. If you say drink 2 cans of it, your odds of getting heart disease, vascular disease, diabetes is up 80%. So it's very important that you not allow your child or even yourself to be drinking your calories. You drink water, put a lemon juice in it, and you tell the children that too, Gary?
I tell the children, all the parents, not to indulge in or use juices at all from actually very early on. Parents like to give juices to babies about 4 months of age. They like to do some apple juice or pear juice because it is available and it is sold in the markets as infant baby juices, you know. And that's where the sweet buds or the taste buds or the abnormal eating patterns begin in children's life right at that very young age. So I recommend them not to use anything sweet. They can do pureed fruits and then use them, and that is okay to use.
That is the sugar. The pureed fruit is the sugar you give the child. You don't give them sugary drinks.
Sugary drinks, right?
They're not any good at any age because they have no fiber in them.
Not at all, not at all.
Yeah, and
not at all.
They develop the taste for fat.
They do taste for the sugar, salt, and all those abnormal taste bud patterns.
Yeah. Let's go on to diet drinks. Now you think, boy, that's a good thing. I'll use a diet drink. Well, it turns out studies have shown if you use diet drinks, actually you gain weight doing it. Now, why is that? It doesn't have as much sugar in it. Well, I tell you what, because it has aspartame, saccharin, sucralose, and even stevia. Yeah, and the reason is that they are so much more sweeter, 300, 400, 500 times more sweeter than regular sugar. And you get so used to that with the other foods you eat, you no longer think they're sweet at all. You start picking foods that are a bit sweeter to try to approach the stevia taste and the stuff. And guess what? You're gaining a lot of weight doing that. Yes. And the other thing they found out is that stevia, sucralose, saccharin, aspartame change the set in your hypothalamus that tells you when your appetite is full or when you're hungry. Yes. It upsets the hormonal neurochemical activity up there, so you can't tell anymore when you're full or if you still have a horrible appetite. So low diet drinks are not the thing. It's water, lemon juice, and there's a few other things coming out.
They're very dangerous because not only they have these, non-calorie sweeteners, they also add a little bit of some of those, add a little bit of salt to that. But what it does basically is it continuously enhances the sweet taste buds to overgrow on your tongue, and then you would want to crave for it even, if you don't see any of those drinks, you would crave for it. The next thing it also does is, since they don't have any calories, you are drinking the juice and your body understands, okay, you're drinking something sweet and you're going to get some calories and it'll settle down your appetite or your hunger or thirst for calories. That doesn't happen with these diet drinks. So you keep on drinking 2-3 liters of that. I mean, at times kids drink that much. And then it actually interferes with your normal glucose metabolism. So once that is interfered, then you're getting the sugar, the sweet rush, but you're not getting calories along with it. So you'll have to fulfill that calorie need with more calories subsequently.
Thank you very much, Gary. The other thing, they did some rat studies, studies on some rats, and some of them had become addicted. They got them addicted on cocaine, and then they gave them some of these things. Guess what? You know what they went for? They went for these sugar
cocaine.
Substitutes,
Right.
and not for the cocaine. So those substitutes are more addictive than cocaine. Let's
Exactly.
remember that one.
That's
And
right.
there's a real animal study that was done. Let's talk about fast food restaurants a little bit. Many parents, they're busy, one thing or another. Half the meal of a child is in a fast food restaurant. Very, very dangerous thing. Very dangerous thing. I think we both feel that way. But there's cookies and donuts and some of these and French fries full of fructose corn syrup.
And
Very dangerous chemicals to your child. And as I mentioned, when I see them ordering French fries and a big old fatty cheeseburger and give it to their beautiful 6-year-old child, I mean, to me, I don't know if you feel that way or not, Gary, but I feel it's child abuse.
I tell parents continuously to avoid these things basically because it's so tempting. They think it is fast and easy, but it is loaded with so many calories and so much of toxic substances in that diet that it'll throw their metabolism off, and they consume a lot of calories and then get addicted to these kind of foods, and then unusually gain weight pretty rapidly. Yeah.
This might be a good time to speak again about fructose corn syrup a little bit. We started manufacturing that around 1970 or so from corn. It is extremely sweet, and we consume a great deal of it in this country, like 18.5 billion pounds of it a year, and most people consume a great deal every day, and about 60 grams a day actually. I mean, it's an unbelievable amount. Well, fructose corn syrup, as in manufactured fructose, is not the same fructose from fruit, for example, which is very healthy.
Yes.
And it's in a combination with sucrose. Well, it heads straight for the liver. It's not metabolized in the blood. And what does it do in the liver? Lipogenesis. It forms fat. LDL goes up, HDL goes down, so it paints our arteries, and is a big cause of vascular disease, diabetes. And remember what we said? Children start painting their arteries for vascular disease at age 2.
At age 2,
the heart attack at 35, 40, or 50. When did the problem start? As a child. As a child.
Very early. Very early.
You have a heart attack at 40. The disease doesn't start at 39. It started at 2, 3, 4, 5, 6.
Right.
60% of the teenagers have an elevated cholesterol. Every child, large or small, no matter what the family history, should have their blood figures checked at a young age. Now, I know you do that regularly, and I've always admired you for that. For the fructose corn syrup, it doesn't turn the appetite off. That's the reason you can eat one donut and you can eat the whole darn thing. You can eat 12 of them.
Can't stop eating.
And you're still hungry because the insulin level didn't get up, and it doesn't increase the lipase, which turns your appetite off. So it's very important to consider. Let's review the secrets a little bit so we really nail this down. In my book, The Secret of the Non-Diet, what I'm really saying is all carbohydrates, which are these sugar chains that make up, carrots and potatoes and vegetables and broccoli and cauliflower, they're not all alike. That's the difference between complex and simple carbohydrates. Now, a simple carbohydrate is single chains of sugars, okay? White bread, white rice, for example, would be a simple carbohydrate. And the complex, and you can look here at the food pyramid on the screen now, the good foods at the bottom. I gave it a 10. And this is full of vegetables and cauliflowers and peppers and tomatoes, and above that you see fruit. Remember the rainbow of fruits, and next beans, all types of beans, and then above that you see nuts and whole grains. And you notice we put meat at the top. We don't want you to eat a lot of meat, if any. Gary would say to his children, don't eat any. And I, allow adults to eat a little bit, but if you get advanced disease, don't bother with it. And if you want to be very healthy, don't bother with it to begin with. And why are these vegetables so much more healthy? Because they have the phytochemicals, the vitamins, the minerals, but also they have fiber. Fiber is complex change of sugars. For example, a nut would have a lot of fiber, or broccoli would have a lot of fiber, or kale would have a lot of fiber. It prevents the absorption of cholesterol and HDL and a lot of sugars. So if you eat a complex carb, you'll absorb at best 70% of it, 30% will go out the stool. If you eat fat, 97% will sit on your belly or your buttocks within 4 hours. Only 3% use up metabolism. If you use a lot of oils like olive oil or other oils, and people always say olive oil is just great, but a little bit's great, but not a lot of it. It's 100% fat. You know how long it takes oil to get inside your bloodstream if you use it in a salad, Gary? 4 minutes.
You're right.
That's something I learned recently. I didn't know that. And so 90% of your fat is absorbed by the body. Only 3% lost in metabolism. So high sugar, simple carbohydrates increase hunger, cause sugar addiction and cravings. And I remember years ago, I used to go play tennis with my friend Dr. Crawford, come across town, and I'd be hungry from working all day, and I'd stop and get some French fries and eat a little hamburger, and it would increase my sugar, and I'd feel real great. In the middle of the first set, Dr. Crawford comes in and says, "Boy, Rudy, you're really not moving very fast." Well, that was when the sugar dives down. That's the reason you don't want to eat these simple carbs, and they're accompanied by so much fat to begin with. So complex carbs promote weight loss, prevent, stop, and even reverse disease. Dean Ornish published books stopping, preventing, reversing heart disease. Dr. Esselstyn did it also. They prove with angiography that indeed these diseases can be reversed. We have in our body 100,000 miles of blood vessels. That's correct. So to clean out a little artery this much, what do you think that's going to do for you? Maybe a little bit. It's the other vessels we'll all have to work on. And I remember, Gary, a while back, you were sort of 60% this way, weren't you? Now you're sort of 100% this way.
I went all the way. I went
Yeah.
complete 100% in terms of the plant-based diet
Yeah.
and avoiding all the animal products, including the eggs and the milk and
Yeah. Yeah. Eggs are
and
really
some of
not
the
a health
oils.
food, are they?
No, they're not the way, because the protein in the eggs is again very inferior quality compared to the proteins you get from the vegetables and the legumes. And also with every egg, you also get a lot of cholesterol, which you actually don't need it, which is not there in any of the plant foods. So
I think I told you before once, I read recently what they do to a chicken after it's born. And I used to eat egg whites, to be honest with you, for some protein. I totally stopped it. When I read that, what they do to a chicken is inhumane, and I will not touch an egg anymore. And you couldn't treat a living thing like that. We believe in pro-life. I believe in pro-life of all life.
Yes.
Of all life. And so complex carbohydrates promote weight loss, prevent, stop, and even reverse disease. That's the beauty. If you're an adult watching this, you have advanced vascular disease, for Pete's sake, get on this way of eating. We can reverse your problem. And not just stint it, we can reverse it and cure it. A stint will not cure it. This way of eating, this can cure you. So it's important to know. And so the fiber in complex carbs absorb the fat and cholesterol, and you take it out in the stool. And I think it's a very big point. And refined carbohydrates, that's carbohydrates with the bran taken off the kernel, for example, now it's pure sugar, reduce your good cholesterol, your HDL, your heavenly cholesterol, and increase your triglycerides and blood pressure in fat stores. foods that promote weight loss are high in complex carbs. Take a lot of energy to break them down. We mentioned that. I think
Yes.
we're driving that into the ground, but I think
Yes,
it's important.
always.
And they increase also your feel-good hormone, your serotonin level. And when you're eating complex carbs, what it does is it pushes tryptophan, the precursor to serotonin, into the brain. And then you have more serotonin, your appetite goes down, and you feel good, and you eat less. Remember, food's a drug, right, Gary? I mean,
Oh, it is definitely.
we
it is.
use food
As-
for make us feel good, don't we?
Yes,
And,
it is.
we're all familiar with that. And so we recommend reducing the saturated fat. You know, we talked about saturated fat, which would be fat on a steak, for example, versus unsaturated fat, which you would find, for example, in a bean. You find
Yes,
unsaturated
yeah.
fat more commonly, or in omega-3 fish oil, for example, or sardines, or herring. They all have the good fats in them. So saturated fat increases artery clogging and your lousy cholesterol. And where do you find unsaturated fats? Fish oil, walnuts, flax seeds,
Flaxseed is a very good, and also chia seeds.
and chia seeds.
Yeah, chia seeds.
Do you take some flaxseed every day?
I do. That is part of my regular. I take about
Yeah.
2 to 4 tablespoons of flaxseed mixed with. I mean, I usually mix it with my breakfast or even with fruit and veggie smoothies.
Yeah.
And generally you can sprinkle on your salad if you want to, but
Yeah.
somehow if you take about 2 tablespoons a day, which is not a whole lot of flaxseed amount, that gives you the necessary, very important, vital, the omega-3s and the 6s you need.
Yeah, the good fats. The
Good
omega-3
fats,
are the good fats.
yes.
The omega-6s are the bad fats.
Right.
And they should be about equal. Tell us a little bit about, I know we spoke last time a little bit, but again, it's such a wonderful thing about juicing and smoothies a little bit.
Smoothies, right. I mean, it is a good addition to your regular diet because we wouldn't be able to get a lot of vegetables eating all day if you're just eating. It's a lot to eat, especially if
Yeah.
you're on the go and if you're
Yeah.
not at home.
Yeah.
So smoothies is a good substitute. You can start with actually fruit smoothies and then start adding some vegetables to that. In fact, kids also would like it. I've seen so many kids try it and then initially hesitate because they think it's vegetables and must be tasting yucky or something like
Yeah.
that. But once you get them going with the fruits and add maybe a couple of leaves, a few little bit of spinach, lettuce, and maybe some tomato and carrots to that.
Yeah.
But the fruit, you're adding some pear, apple, some orange to that, maybe some banana, strawberries, blueberries. It is so delicious. Kids are loving it. Kids
Yeah,
love it.
You've made
actually.
them for me, and I just can't stop drinking almost
Delicious.
my whole meal.
Yes.
And Gary is an absolute smoothie and a juicing expert.
I
and
can
in a
do
smoothie,
some.
it's the whole plant, right? The whole apple, the whole carrot.
Yes,
And
so you
in
do the whole
juicing,
thing.
there's some pulp left at the end.
You're
And,
not you're not getting a lot of fiber, but you're getting a lot of nutrition,
Yeah.
especially for older people and children. If you're not a child, then
Yeah.
you don't need all the sugar to handle. So
Yeah.
I would recommend initially, if they're not into any of these things at all, they can start juicing first and then get
Yeah.
the hang of it, taste of it, and they can go to smoothies eventually.
Yeah, use both,
I-
juicing and smoothies.
Smoothing
yeah.
both, yes.
Yeah, and we use the Vitamix machine for the smoothies, very good. And there are many other machines too.
Oh, there are a lot of
Yeah,
machines,
yeah,
but
yeah,
Vitamix is a very good,
Is a
dependable
good one,
machine
Yeah, and Jack LaLanne's machine for
this juicing, yes.
for the juicing. Yeah, you're an expert. I've watched you do it, and it's just a wonderful habit.
Well, we had a fun that we had a lot of fun that day, and a lot
Yeah.
of children were there, and they
Yeah.
were really
Yeah.
enjoying the different tastes and flavors
Yeah,
of
we
the
teach the
vegetables.
children. And I'll tell you one thing you and I have learned. It's a lot easier to teach way of eating to children than it is adults, isn't
Yes,
it really?
yes,
Children
yeah.
just love it.
They love it. In
Yeah,
fact,
yeah, yeah.
that day when we started
Yeah.
with juicing fruits and all, but I added almost every vegetable that was around.
Yeah.
Beets, cucumbers, lettuce and
Yeah.
celery and everything else.
Yeah, if you want to know when our next cooking class is, maybe call your office or look at my
Sure.
website, KACHMANN, and look at our website. We'll put the date on there.
Yes.
And we take adults without kids to come and just watch us. they'd probably end up with a free meal, wouldn't they, actually?
Oh, yeah,
In
that's right. Yeah.
Of healthy
It's
food,
a
of course.
delicious meal,
And
yes.
we have the kids stand up and tell us what they learned that day. I mean,
Yes.
it's a beautiful thing. And so olive oil is not a health food, is it? We decided that a tablespoonful is okay, but it's liquid fat.
Liquid fat without any fibers, other nutrients in
You
it.
got it. You notice it's not in my food pyramid.
True.
And my
Good
very
thing.
good friend, I won't mention his name, whose book I got here, he's got it on his food pyramid. But,
Yes.
but I don't think that's a good idea.
I wouldn't like that
Because
because
he doesn't
again,
believe it himself. And
Right.
tablespoonful, he'll say. But
Right.
and
I mean-
and breastfeeding, as we would mention, is the best gift you give your child because breast milk has in it it has in it these omega-3 fat cells that build your child's brain.
Yes.
And these great immunoglobulins and these live cells which your child needs for proper body growth. And incidentally, and we already spoke about that plant protein is just as good as animal protein. The only difference, because it's all broken down into amino acids, then it's rebuilt into about 100 to 200,000 protein compounds. But it all starts with these building blocks. They can come from plants and animals, and plants have no cholesterol, no fat, no nasty chemicals, much healthier. Many big-time athletes are pure vegetarians, but we don't call ourselves vegetarians. We're calling this the non-diet, the high nutrient-dense way of eating. Incidentally, the American and Canadian Dietetic Association have said that a well-balanced diet like we're talking about is completely healthy for any child of age 2. You don't have to eat meat at all.
No, you don't have to eat.
You don't have to eat meat at all.
You can get all the nutrition, including very, highly important
Exactly.
proteins from the vegetables itself.
Yeah, and if you eat this way 100%, actually, you'll lose about 3-4 pounds a week if you're overweight. Yeah.
Definitely, yes.
But
Or
remember,
even
if
more.
you're a parent and you're overweight, your odds of your child being overweight is going to be great. And I'd like to spend again a minute talking about the psychology of it a little bit, the image in the mirror. I'd like to talk a little bit about the image in the mirror. Frankly, sometime really have a look at your kid. You really have a look and make sure that you're not seeing a thin child when in reality it's an obese child. You got to know the image in the mirror. This is very important. Look at yourself, look at the child, have a realistic look. Your perception may be completely off, and that's human. You know, I know anorexic woman that works out in my workout place, and someone asked her what her image was because she was literally destroying her body by over-exercising. She was in protein metabolism, I think ketone metabolism. And we asked about the image in the mirror, and what she saw was a normal person that was angry. But she was extremely thin, so she needed counseling, and we arranged it for her. But if you eat this way, you're going to lose weight pretty quick. You don't even have to weigh yourself. It's going to just drop off you, and you'll be healthy as can be. And so in terms of terms a little bit, if you know them, vegetarians don't eat meat, although a lot of vegetarians do eat milk products. But some
yes.
it's very limited. A vegan doesn't eat meat or dairy, okay? A flexitarian is a person like myself who is about 80%, because my weight's 145, it's normal, so I can eat a little fish, or if I wanted to eat a piece of chicken occasionally, but remember I mentioned chicken's not a health food. It's like eating a donut. There's no nutrients.
Nutrients.
It's like eating a donut. There's no nutrients. It doesn't have any of those chemicals we talked about.
You're right.
So it's not a health food. And then we have nutritarians like Dr. Furman who are eating, but he's really a flexitarian. He allows a little bit of meat. So I think Furman and I really, frankly, are alike. And so a nutritarian is nutrient-dense food, and a person that considers that would be called a nutritarian by Dr. Furman. You could call him a flexitarian. So the non-diet, I'm talking about the book I wrote, it's a way of life. Eat all you want. If you eat that food, essentially all you want, you'll not gain weight, and you'll be perfectly healthy. So I prefer that term, and very little portion control is necessary. Incidentally, with children, don't regulate the amount they eat. If they're eating the right food, ignore it. If they eat the right food, they ignore it. If your child, suppose you catch it now at 7 or 8 and you're trying to change the way they eat, the mother controls the buying of the food 90% of the time. You need to just change it. You don't even have to talk to the child. If bad food is not available, they'll eventually eat. They may skip eating a day or so. Don't worry about it. When they get hungry, they'll eat. Then they're studying the right food, and their taste buds will change. The mother's the boss 90% of the time, and you got to lead the way. But then eventually teach your child what good food is. I think a great habit is to teach your child to cook. Teach your child to cook. They love it.
Take part in cooking.
Take part
very
in
essential.
it. And then they appreciate and the beauty. You know, look at the food. If you look at the food that you and I do juicing on and smoothies on, when you look at it,
Yes,
my
delicious.
God, it's gorgeous food. You just got to look at it. Food's of color, you know, it's really a beautiful thing. And most of us, when we eat, we're too busy. We never look at our food. It's a good habit to look at the food. I was giving a course at IU Purdue on wellness not too long ago, and there was a girl that was pregnant in there, and she was developing diabetes. And I taught her this way of eating, and within a month, her diabetes went away. So you can't continue with diabetes as the mother. You got to change the way you eat. You're going to affect your child. You're going to affect the size of the brains of your child. And remember we said during pregnancy, no caffeine, nicotine, alcohol, drugs, medications, unless they save your life. You cannot take medications because you don't know what's going to do to your child. And only 20% of mothers breastfeed past 6 months. We'd like to get it higher than that, obviously. Again, to review about what to feed your child, say 6 to 9 months, introduce new foods gradually, fresh foods, apples, pears, peaches, and vegetables cooked in the pressure cooker or steamed. This is out of Furman's work, and I think we already spoke about that. And try to avoid the first year fish, red meats, cow's milk, fatty cheeses, butters and oils. Fruit juices we shouldn't bother with. We already spoke about that.
Juices are not just because they don't have any nutrients in them except free
Yeah.
calories. Although it says natural juice on that,
Yeah.
I tell parents to stay away from it because, again, it doesn't have the things the fruit has,
Yeah,
which is 1,000 times better than the juice.
yeah, has no fiber.
No fiber, and the
Yeah.
juice is so dangerous, it'll raise your sugar levels
Yeah.
and insulin levels, and then have rushes, ups and downs of the sugars, and they eventually end up eating more.
And it's really like drinking pure sugar, isn't it, really?
Yes.
Yeah, juice is like drinking sugar. And breastfeeding, remember, has active enzymes, good fats, proteins, live cells. Mother's milk is extremely healthy. Much less infections. Mother's milk and high nutrient diet. Much less infection rate in children. Dr. Furman published a lot of papers about that if you eat the nutrient-dense way. And if your child had, if Dr. Furman would find a child with a high infection rate, when he switched them to the nutrient-dense diet, most of the infections went away.
I see that every day.
And you see it every day.
I see that in my practice because all I do is pediatrics for
Yeah.
the last 30 years.
Yeah.
And I definitely see more infections in more problems, more calls, more sick visits to the office, children who are on formula feeding, and significantly less in breastfeeding mothers. And that's one of the important reasons I stress the fact that all the mothers should breastfeed if they, in fact, they will if they actually understand the importance of the breast milk.
Yeah, it's very important for the family doctor, nurse practitioner, or pediatrician to explain to them the importance of breastfeeding, which was, when I speak to many mothers, they didn't know what a tremendous benefit that it was. Most people, they love their children, let's face it. They do anything for their child. So I think if the provider speaks like that, what do you think the mother's going to do? I mean, I trust most mothers. They would do anything for their child. And but it's important to remind them, to teach them. That's our job. What does physician mean? Teacher. Means teacher. We're trying to teach today. The calorie intake for a child normally, I think, 1 year old around 900. They say 2 to 3 year olds about 1,000 calories. 4 to 8 years old about 12 to 1,400. A little difference between boys and girls. 9 to 13, about 1,600 for females, 1,800 for males. 14 to 18, about 18 to 2,200 like an adult. And it varies if you get an athlete there. you're going to eat more.
It varies with the
But-
activity and the.
Yeah. But remember, if you have an athlete there and you feel he needs more protein, that's just fine. But he's going to need more calories because he's an athlete. And as he eats more calories, guess what he's eating? If he's eating nutrient-dense food, he's getting all the protein he needs. Don't need supplements.
Everything,
No, do
proteins,
not need
vitamins,
supplements.
minerals,
Yeah.
calcium, everything comes
Yeah.
with the
Yeah.
wholesome diet.
Yeah,
wholesome
I was reading a
foods.
figure that if you, say, want to gain a pound of muscle a week, which would be kind of unusual actually, all you would need to increase your protein intake is 7 grams.
Wow.
I mean, a cup of broccoli would do it.
Right.
You don't eat a steak. And that's very interesting. And so sedentary active lifestyle will make a difference. We know, we talked about that. Obviously, athletes need more, but they don't need to take supplements. But if you felt like they need a little protein supplement, then find one made out of vegetables. They're available. You can make it, put it in a drink or in the smoothie and put a little extra protein supplement.
you
If you
can do
feel
that.
your athletic high school football player needs it, but make it a vegetable.
Right.
Drink.
Generally, if you're bodybuilding or you're doing a lot of sports and you need to grow your muscle,
Yeah.
I mean, simply, Rudy, the simple fact that muscles don't grow in the kitchen.
Yeah.
You have to go to the gym or somewhere to grow
Yeah.
your muscles. Once you do
Yeah.
exercise and workouts, you'll have increased appetite, and you just feed that appetite with a lot of, again, vegetables, legumes, beans, and some of the nuts and stuff like that, and you will get your daily increased need of protein to grow.
Gary, that
So-
was beautiful. I think I'm going to repeat it a little bit. This is beautiful of what you said. That was to increase muscle mass. It has to be done in the gym. You've got to do,
Right,
you got to
you don't-
feel the strain and the pain, and the
Right.
muscles will grow. But then because you did this, you will increase your appetite, and that will naturally bring in all the protein that you need. Amen to that.
Yes.
I think that's a very good thing. And don't have a problem with a picky eater. You just don't buy the bad food. They'll get hungry. They get hungry. And don't try to regulate the amount your child wants to eat. If a child doesn't want to eat, send them to bed or whatever, or send them out to play. Don't force your child to eat. You change the satiety set. You don't want to do that. And school lunches are a problem. We talked about that. Some schools better than others. And you need to go in there and find out what's the government delivering. Is the government delivering toxic food to your child? They do a lot of the time because they pay the farmer to grow food that we don't need. And they deliver it to the children because of the surplus. And you're eating this junk food, toxic food a lot of the time, fatty food, and that's killing your child. And you think it's wonderful because it's free. So you're going to watch it. Let's face it. A lot of the children get free lunches because of poverty, one thing and another. They're the sickest children around. Who has the highest obesity rate? People in poverty.
Right.
They have the highest diabetic rate. They're not starving children. They're not the thin children. They are the overweight children. And you know from, I mean, you're just a great doctor, Gary, and I know you treat a lot of people that are in poverty. I've been in your office. But when you look around, they're the overweight people.
It is increasing, Rudy. I mean,
And it's even increasing. And I admire you
Increasing.
for treating them, and
Right.
I admire you for facing the problem.
frankly, I'll tell you, I spend about nearly half the time talking about weight in children because we do
Do
a
you
lot of
really?
yes. No matter
Wow.
what they come to the office for, once we because like we talked about earlier, we do the BMIs, weights, and heights in every visit. We know where the kids are, and it's very important. I mean, how could I ignore it, Rudy? How could I ignore if the child's weight is excessive for the height? We at least mention it and bring it an issue to talk about it on a next appointment just for that, and we do that a lot.
You know, I've read once, and I totally believe it, a pediatrician should be a wellness doctor. And that's what you are. And Gary just said, he spends 50% of the time with the children and mothers teaching them to eat right, because both have to eat right.
Both is the whole
Isn't
team.
that
It's not just the
instinct?
child by himself
That is your job.
or
and
one
you're-
child. In
And
the,
you're doing it, that you haven't spent half your time on it is a very instinct. And Let's talk about physical activity a little bit. What do you tell your kids about physical activity?
Physical activity is so essential. It is just as essential as your sleep and your 3 meals a day and bathing every day. So when a lot of mothers or parents or children say that they are going to exercise more to lose weight, I would tell them that's not the right approach, because exercise is not anything new they should be doing to lose weight. Exercise should be a thing of an everyday activity, whether you're thin or you're overweight or you're normal weight. And in addition to your regular activity, just work on the diet, that's where the calories are coming into the body. Because really simply, if you look at it this way, a pound of fat has about 3,500 calories. And if you're on the treadmill to try to burn those calories, you'll need about 30 hours.
Yeah. Yeah.
When do you have 30 hours to burn a pound? And at the rate at which the weight is, kids are putting on the weight, they would never be able to get off the treadmill, the way I look at it.
Gary, beautiful words again, beautiful words again. And the point is, it works the same in adults. If you're trying to lose weight just through exercise, it's going to be impossible for you. You got to watch what you eat. Exercise is important.
It's an everyday thing.
We think a child should do it at least for an hour every day.
Every day they should go out and play, do whatever they like, enjoy it, be outdoors.
TV no more than 2 hours a day, right?
Right, we say about 7 to 10 hours a week. So
yeah. So now let's summarize this a little bit. I think we covered this subject fairly well. That we prefer a complex carbohydrate, whole grain, vegetable, bean, fruit, all you can eat way of eating, and the reason being, it is the vitamins, the minerals, and the 25,000 phytochemicals that are the symphony, that they work together. They work together to run the metabolism of your body, and you will have a proper weight, you will have a proper mind, and you'll have a very healthy child. And as a parent, I think you have to do the same thing, or the child will not be motivated to do, what you're doing. We're going to have some additional shows, and the additional shows that are coming up here very shortly will be, we're going to go to some of the food centers, from maybe Walmart to Myers to the Natural Foods on Sherman, a place that we love, and teach you. And we firmly believe, and I know, that good food actually is cheaper.
It's very cheap, very
inexpensive. It's very cheap. You just got to know how to shop it. And we're going to teach it to you. And then I think we're going to have a cooking class on one of our shows. And we're going to do it at my house with you and your wife.
Yes.
And that's coming up soon. So look for our other DVDs. You can probably get this DVD at my website and maybe at Dr. Marula's office. They'll be available, as well as our books. I've written 5 books on proper eating, called The Magic 5, from psychology to motivation, to The Secret of the Non-Diet for Adults, Secret of the Non-Diet for Children, reversing type 2 diabetes. So we cover this subject, and the reason we're doing it because this tremendous number of vascular disease and strokes we're seeing in this country, and this is one of the worst areas, and we figure the best place to start is with the children. With the children. And I know your parents, you love your kids, so I think you can help lead us in this revolution. So please read our stuff, look at our TV show, and I thank Public Access for giving this opportunity to you and I, Gary, and we'll do another show soon here, and I think we've seen great results in your office. I see some of the children, how enthusiastic they are. They're losing weight. They're getting healthier. Their mothers are healthy. They're coming to our shows. And my plan, Gary, is to change the community. Let's shake hands on that, Gary.
We're working on that. Thank you for your help, too, for doing that.
Thank you.
My patients love to see you there at these meetings.
Yeah, thank you very much. And we thank Public Access TV for giving you and I this opportunity. We thank the audience very much for watching. please contact us. You got other ideas, other shows you'd like us to do. The phone numbers are on there. We'll gladly work with you. And namaste. Thank you very much. So, another show.